I request EAS Sharma ji to go ahead, sir.
We have heard a lot of very useful, we got a lot of useful information. I feel really enlightened. It is very useful to me as a citizen. Now, the subject is what the government should do. I always say the government should do what the people want. So I will give you the input from the people's point of view. So the first one, from a patient's point of view. Second one, from a citizen's point of view. Now, patient's point of view, see, I am actually 80 years old. I am highly vulnerable to this corona. I have taken both the doses of the vaccine. But I got a patient who is about 25 years old, a young boy. And he developed some body pains and all that, and I got him tested. It is a rapid antigen test, and he tested positive. So he has been home quarantined, and he has been taking treatment from a doctor on telephone. So it was all right for some time. Then the doctor said, you monitor his temperature. So I got him a thermometer. He also said, you monitor his oxygen level. I got him an oximeter. But unfortunately, our education system is such that boy cannot read a thermometer or can use it. He cannot use an oximeter. So on telephone, we told him how to use them. It is very difficult. And about 7-8 days, suddenly his oxygen level seemed to have gone down. So I got worried. So what should I do? So I telephoned emergency. Emergency said, look, you contact so-and-so in Vizag. This is a centralized emergency in Andhra Pradesh. So I contacted the local people. They were very good, very responsive. And finally, they said, we'll send a van and take him to the hospital, a government hospital, very well-known hospital in Visakhapatnam. So the van was about to come. Then they said, sir, that boy has got a written documentary proof that he is tested positive. I said, no, the lab people came to my house, tested him, and they did the rapid antigen test, and they showed him the test, and there is nothing, no SMS, no written thing. No, sir, he needs an RT-PCR test positive. Now, I checked up RT-PCR test in Visakhapatnam. There is a long queue. You have to go at about 4 o'clock in the morning. You have to stand there. A man who is, has his lungs congested and his oxygen levels suspected to be low, you can't expect him to stand in a queue. So what do I do? Now, I tried to get him an oxygen cylinder from the market. So I telephoned all the private companies. Oxygen is in shortage. It is not available. Somebody said, sir, after 2 days you telephone me. I'll let you know whether the stock is there or not. So there is a serious shortage. Now, this is the kind of position today where ambulances are not there. Hospital beds are not there. Oxygen is not there. You telephone any medical shop, drugs are not there. Leave alone remdesivir, even ordinary drugs. Whatever Dr. Manjunath said, very often, they are not easily available. So in this situation, how does a patient really deal with this? I mean, see, what the government should do and all is very easy to say. So this, what I feel is, the Bombay Municipal Corporation, there is one Iqbal Chahal, who is a commissioner. He has introduced a model which I thought was very, very effective, and every other government should adopt that. What he has done is, the moment there is a call from a patient, the Bombay Municipal Corporation takes over the patient. They send a vehicle, they get him tested, they decide whether he should continue in home quarantine, or whether he should go to a corona center, or whether he should go to a hospital where there is oxygen and ICU facility. Everything they do. And they've got a dashboard. They know every private hospital and every government hospital where beds are there. They have complete real-time data. And it's their responsibility to move the patient wherever he has to go. And then they take over the treatment. Now, the results are very, very impressive. You see, Bombay is a huge city. And there is a lot of migrant labor. There's a lot of moving traffic. But still, Bombay Municipal Corporation, the number of positive cases has come down. The mortality rate has come down below 0.5% in a record time. So I personally feel that this is extremely important. One important thing from a patient's point of view, when I failed with all the government hospitals because they want a test certificate, I checked up with private hospitals. Now, private hospitals want these people to deposit 3 lakhs, for which they do not issue a receipt. They issue a receipt only for 50,000. Now, this is the kind of fleecing, fleecing patients, the private hospitals. So this is the kind of thing that is happening. So I was thinking that this Bombay Municipal Corporation kind of thing will reach out to the patient, take over. The government should take over the responsibility and see that he is treated properly, given all the facilities. I think is extremely important. Now, citizens' point of view. Now, as a senior citizen, I was supposed to get my second dose. And it's impossible, I tried to contact everybody and information was not really readily available. I used Arogya Setu application. It won't work. COVID website, the information was wrong. I scheduled appointments, they were cancelled, and it's impossible to do anything at all. So finally they said, look, there is a municipal public health center. You go there and you take your second dose of vaccination. So my wife and I both are senior citizens. So we thought we'll be somewhat careful. 8:30 the center will open. So we went at 7:30. And in front of me, there were 100 people waiting there, all old people, very aged, disabled, with walkers and whatnot. And I waited for 4 hours in the queue. Ultimately, I got my second dose. I feel very confident now. Now, from the citizens' point of view today, I was calculating India's population is about 1300 million. Out of whom, with all this hoo-ha and all this great Tika Utsav and all that, we could vaccinate only 100 million, even less than 100 million. So we have got another 1200 million people to be vaccinated. Imagine about 80% of them to be vaccinated. It comes to about 960 or whatever it is. Now, this 960 people, we have to give them 960 million people. We have to give them vaccines. I calculated if they have to be vaccinated in 3 months, you have to have vaccination rate of 11 million per day. 4 months, 8 million per day. 5 months, 6.4. 6 months, 5.3 million per day. What is the capacity of India vaccine manufacture? 4 million per day. If Serum Institute ramps up its capacity to full capacity, government has given them hand. And even the Serum Institute chairman managing director said, up to June, July, we will not be able to ramp up. So it looks as though that we will vaccinate everybody within 6 months in India. It seems to be like a dream. You have to import vaccines. And importing vaccines is not easy because every other country is competing with you for vaccines in the world. After all, the world's vaccination capacity, vaccine manufacture capacity is limited. So here the question comes, you're not going to find vaccines so easily. There is a shortage. And how do we tackle that? Whenever there is a shortage, you must prioritize. The prioritization is very clear. 65 plus senior citizens, comorbidity people, then 45 plus people, pregnant women, children, 18 plus. So this is the priority. I was surprised when the Prime Minister announced 18 plus, we're opening on 1st of May. How do you do that? The moment you do that, the vulnerable sections are going to lose out on vaccine. It's a very, very serious matter. I don't know how they don't make any calculations. So in my view, it's extremely important that we prioritize and then we realize, we calculate the exact shortage of vaccine and we prioritize according to that. We have a time schedule according to the availability, indigenous availability, what we can import. We should quickly place orders, and all vaccines must be given free for all people below poverty line. And they should be given masks free. Is extremely important. I personally believe more than vaccine, as Dr. Manjunath said, and also Dr. Rakesh Mishra said, it is the physical distancing, social connectivity, and a proper mask, double mask probably is absolutely necessary. And in this country, there is no time for electioneering, large election campaigning in Bengal and all that. They are all super spreaders. Kumbh Mela was a super spreader, farmers agitation. The government doesn't settle. That becomes a super spreader. In every state, I find religious congregations and even some of the powerful, influential industrial units, they want environment clearance. So they want a public hearing. So in spite of all this Ministry of Home Affairs guidelines and all, our India pollution control boards in Karnataka, Tamil Nadu, Andhra, everywhere, they're holding public meetings. I said, look, you can't have public hearings when Corona is spreading. Andhra Pradesh, today the number of cases added every day is almost about 20,000. So many days, crematoriums are full. So this is the kind of thing where so we should prioritize and vaccinate our people according to their priority. Now, the most important thing is what are the long-term measures? I was looking at the reports for the Ministry of Health, Government of India. The 2015 report on primary rural health centers and also the urban health centers, the infrastructure, that is rural health, district hospitals, super specialty wards, if you take the whole health infrastructure, the shortfall is about 30 to 40%. So the national health policy of the government of India in 2017 said, today we are spending only 1% of the GDP on health sector. You have to increase it to about 2.5 to 3%. It's very clearly written there. Now from 2017 till 2020, that is before first wave of corona, we could have built up this infrastructure. In my view, governments exist only for two sectors, health and education. These are the most important investments in public sector. So the government ought to have invested. They did not do it. So corona came and exposed. It exposed our weakness. The ambulance is short, hospital beds are short, oxygen and drug, your cremation grounds, every city must have electric crematoriums. In Visakhapatnam, there is one which does not work. For the last several years, I've been asking them, why don't you set up these crematoriums? They are hygienic. They have not done that. So in a way, long-term investment is, I was surprised, 2020, the first wave, when the relief came, when it started abating, I thought that the government would wake up and increase the allocation, budgetary allocation for health sector. I looked at the figures, I was surprised. No increase at all. They were absolutely nonchalant. Government was nonchalant. They were talking, there are a lot of words, but no deed. And the health sector budget remained stagnant. And I remember CCMB, Rakesh Mishra's institute, a world-class institution. I remember Pushpa Bhargava and all that in Hyderabad. I am from Hyderabad. I used to be in touch with them. It's a remarkable institute. There are many laboratories in India, CSIR labs and all that. They are outstanding, world-class. But government has to support them. And I was surprised when the new mutants came. I'm told that genome sequencing work, the government ought to have funded all these institutions in a very big way and gone all out. But there was a setback because there was a relief. Everybody thought that first wave is over and we have conquered this virus. And that is a self-congratulation. So in the process, what happened was there was a setback and we ought to have gone all out for testing, new testing methods, scientific research. See, after all the vaccine development in India for the last 20 years, it came because of India's investment in science and technology. And we must remember that. Today we have got indigenous capacity to produce vaccines because of that investment we made in science and technology. So this particular thing, this third wave, fourth wave is all right. There are new pandemics coming. Many new pandemics may come. So we should be prepared for that. So our science, technology, everything must be strengthened. At least there's a wake-up call. We should do that. So I personally feel these long-term measures are equally important. So I hope that the government, I have written letters to the Prime Minister, the Finance Minister, the Health Minister. They don't reply much, but then I hope they take into account some of these suggestions. And I've given them a plan of action. So I think the more important thing is to have a cogent action plan, a strategy, and we should be able to meet it. And I personally feel this politicization, some party versus some party, state versus center, all this in a pandemic situation, center, states, all political parties, they must be a committee. Stop bickering, because the country wants to conquer these pandemics. We don't want this great, political bickering and all that. So I think we must have a national committee. I call it a national committee. Center, states, and all political parties should be there, and they should oversee vaccine distribution, vaccine prioritization, how the whole strategy is implemented. I think that's extremely important. Thank you very much.
Thank you very much, sir.